welcome back to another Wednesday Wisdom with me, Sarah Palumbi, Marketing Director at FootHealth Battersea. It's May, spring is finally here. The sun is shining and summer is well on its way. Well, it would be if there wasn't so much wind. But having said that, there's definitely a sense of change in the air with more people out and about. And after a year of being barefoot or wearing slippers, as one of the non-clinicians within the FootHealth Battersea team, I've been working from home. I can tell you that getting back into shoes and trainers has taken its toll, especially as I've been attempting to build some exercise into my routine. I found that without my shoes and therefore my orthotics, I've gotten back into some bad practices which have caused some pain in my knees and hips. And if you can relate to this and you're also experiencing foot, ankle, knee, back or hip pain, then it may be a good idea for you to come in and see us for a BME or biomechanical examination with gait analysis. And it's exactly what our new patient Lynda has done. We caught up with Lynda just before her appointment last week, and we'll be following her BME journey with us from initial treatment all the way through to her orthotic fitting and beyond. So Lynda is 33, she has a pretty hectic life running around after her 4 children and running her own small business. She also suffers from Ehlers-Danlos syndrome, which affects her connective tissue, resulting in, among other symptoms, extreme hypermobility and lax ligaments and joints.
Yeah, just uncertain about what's going to happen, I suppose. So my feet are currently moving inwards, which isn't helping my back. So I'm hoping to see if I need some orthotics to help my posture and my knees.
Do you want to take a seat? Okay, perfect. So I see you've obviously had a orthotomy made before.
Yes.
Okay. So tell me a little bit about your history of your health and previous treatments as well.
So now Veronica is asking Lynda about her medical history, any previous treatments that she's had, as well as the fact that she does have a set of orthotics from a previous supplier. Lynda has got some medical conditions which have exacerbated her symptoms, and she's running through what she has had done in terms of treatment for those over the years. All of this, as well as Lynda's lifestyle, her job, how often she's on her feet, whether she partakes in any sports, all of this is giving Veronica a really good idea of Lynda as a whole picture, so that she can then continue with the assessment. So now Veronica has taken Lynda's orthotics so that she can have a real good look at them and make a note of that as part of the assessment. So it's really important, if you do have a pair of orthotics already, please do bring them in for your appointment. So Veronica is now continuing her physical examination of Lynda's lower limbs and feet. She's also continuing to ask questions about Lynda's medical history and really filling out that full picture of what's actually going on here with Lynda. The physical exam then continues with Lynda stood on the treadmill. Veronica can really get a good idea of what's going on with her legs and her feet, her hips and her back by seeing her stood up. Lynda is now doing a slow walk on the treadmill. Obviously I've sped it up so it looks like she's running, but she is just doing a little walk there whilst Veronica gets set up. So along with our treadmill we use a piece of equipment called Optigate, and that's what those blue bars you can see on either side of the treadmill are, and also the camera behind the treadmill. We are going to go into a bit more detail about how this all works in our blog next week, but for the meantime the tripod holding the camera is filming the backs of Lynda's legs and feet, and there's also a camera down to her right that's getting a side view as well. And these images are then shown on the computer screen off camera on the right. So we're actually going to leave this video here, but we will be doing a second part which will then show the scanning process where Veronica is essentially taking the prescription for Lynda for her orthotics. Well, that's all from me for this week's Wednesday Wisdom. Keep an eye on our social pages for more of Lynda's journey. If you have a question that you would like us to answer or a topic you would like us to cover, please message us on Facebook or email info@foothealthbattersea.co.uk. Goodbye for now.